So today I'm going to give a presentation. It's called Unveiling Disparities. Unveiling Disparities, a data-driven exploration of African American health experiences. So today we're going to focus on cancer because there is a number of health disparities that affect the African American community. So in the United States, African Americans exhibit disproportionately higher incidence of mortality from pervasive health disparities, including but not limited to hypertension, diabetes, cardiovascular disease, cerebrovascular accident, compared to other racial and ethnic groups. So today, what we want to do is we want to understand and substantiate the key drivers of health disparities among African Americans. So first, we talk about what is health. There's something in the chat. Okay. All right. So first, we want to understand what is health disparities. Well, our health. Health is more than just a biological phenomenon. It's intertwined between social, economic, environmental contexts that shape the lives of the African American community, or any community at that. So today we want to just have a step back and talk about, in the tapestry of American society, the threads of health and wellness are woven into the very fabric of our shared existence. Yet there's an undeniable and deeply troubling reality that persists within racial and ethnic groups, right? So there's a stark contrast in health outcomes that disproportionately affect African Americans. So one thing I'm going to make clear, or make sure that we all are on the same page, is that we have a solid understanding that health is a fundamental right. Yet for many African Americans, it remains an elusive promise. It's tangled in a web of historical, social, economic, and systemic complexities. So as we mentioned before, from the corridors of health facilities to the hearts of communities, health data paints a sobering picture, a picture where the burden of disease, limited access to healthcare, the weight of socioeconomic determinants intersects a nexus of inequalities. So what I want to mention today in this talk is that health disparities faced by African Americans are multifaceted, and they stem from a complex interplay of both individual and systemic factors, such as a higher rate of chronic disease, cardiovascular disease, cancer disparities, maternal and infant mortality rates, HIV or AIDS, access to healthcare, and much more. So, in this talk, I want to briefly mention that there's a way that we can understand the key drivers of health disparities among African American communities. But it's very hard to do so. So the reason why it's hard to do so is there's a multiplicity of social determinants of health, right? As we mentioned before, health is more than just, a biological phenomenon, right? It yearns for a critical examination by diving into the roots of these disparities, not only to raise awareness, but to catalyze change, to foster a society where health equity is not just an aspiration, but a reality for every individual. Right, so to do so, what we're gonna quickly talk about is how can we go about doing this and identifying these key drivers of health disparities. So first, we must take a step back and investigate healthcare assumptions, including misdiagnosis or late diagnosis, and an incidence of mortality rates. Recently, there's been a couple doctors working on health notebooks for doctors that need to understand that different types of diseases show differently in African American patients. For some, when you get hives who have lighter skins, you get rashes, red spots. It is very apparent that something is wrong. For some African Americans, hives may not be red. They may not be as bumpy. They may not be as apparent, and it looks like a simple skin rash, or it looks like if you have just been bitten by a mosquito. These are on the surface of the skin. What about if something is wrong with the lungs, the pancreatic system, the lymphatic system, the nervous system? Things look very differently when different ethnic groups and racial groups are to be considered. Next, we need to examine environmental risk, racial attitudes, health insurance coverage, geographical agents, and underlying conditions. Now, what does this mean? So to achieve a paradigm shift in education and health equity, what I want to do is to posit a need to navigate the landscape of health disparities among African Americans, not only to expose these challenges, but to also amplify the voices and narratives that go unheard. So this talk, though maybe shorter in slides and more verbal, is a call for action, urging policymakers, healthcare professionals, data scientists, computer scientists like ourselves, and the society at large to confront the structural inequities that perpetuate these disparities. So the last thing we want to do is how can we determine the multifaceted factors? So this can be addressing present, past, and future systematic or systemic environmental and socio-cultural factors that exacerbate health inequities, right? So as I mentioned before, to address this present issue that we have right now, we must acknowledge the past, and in doing so, forge a path forward towards a future where health is indeed a right that is afforded to all, regardless of ethnicity or race. So, as Dr. Gupta just introduced me recently, why is a computer scientist like myself doing health research, where my background is in trustworthy AI? I have a Ph.D. where my thesis is focused on racial, gender, and gender disparities in conversational technologies, NLP. Well, the question is not why health research. Why not health research? Now, health, again, is a right that should be afforded to everyone. So with the expansive growth of artificial intelligence and its subfields, machine learning. And its subfields, machine learning. Oh, sorry about that. And its subfields, machine learning and natural language processing. Large-scale statistical analysis can be performed in aiding in the automatic interpretation of unstructured textual data, such as diagnostic reports, electronic health records, patient records, insurance data, and so on. So moreover, we can most likely systematically identify trending of social determinants and barriers to health equity patterns by investigating multiple sectors, such as cancer. So one thing I want to make sure is that I want to answer the question, so why health? Well, by leveraging cutting edge cutting-edge methodologies. This research aims to provide a nuanced understanding of these disparities from a computational perspective and inform evidence-based interventions and policies. So this exploration is targeted not only to underscore the glaring gaps in health outcomes, but to also unravel the intricate layers that have contributed to this discerning status quo. Before I continue, is there any question so far? Am I speaking too slowly or too quickly, and anyone wants me to slow down?
Dr. Dacon, we will take the questions after your presentation. Yeah.
Oh, okay. I just wanted to make sure everything is clear.
Sure.
Okay. All right. So, moving on. So, as looking at cancer disparities, as mentioned before, there's multiplicity of them, right? So, in the African American community, there's higher incidence of and mortality from cardiovascular disease, cerebrovascular, cancers, mental health, and a ton of other chronic diseases. So health disparities among African Americans persist as deeply as rooted as prevalent challenges within the United States. United States health system. Despite the advancements in medicine or medicinal science, such as biomedical text mining, large language models that use birth and treatment health data, they still fall very short in actually addressing the problem of seeing what is actually wrong. What are the stark contrasts in health outcomes, access to quality care, and overall wellness that persists within this population? So, in the nick of time, and due to the time constraint, I would like to just focus on cancer. Now, what is cancer? Well, the very short definition is a disease which abnormal cells divide uncontrollably and destroy body tissue. Or in other words, or AKA, cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. Well, these things are out of our control, which prompts us to ask questions are, what contributes this? Or moreover, research questions from a research perspective. What are the contributing factors that inhibit these health disparities among African Americans? Right? Then, from a social perspective, how do these factors, when found, interact to shape the lives and experiences of African Americans? According to cancer.org, here is a comprehensive list of types of cancers that are found in the body. Now, these are categorized by system. We have a couple different systems: head and neck, digestive, urinary, lung, breast, reproductive system, endocrine system, skin, bone and soft tissue, eye, brain and nervous system, blood and lymph system, other cancers. On average, we've done a study as well, just on average. If you ask someone, can they name the systems? Kind of hard, because you ask regular citizens every day, and it's not readily identifiable. Now, if they can identify systems, can you name at least 3 from each one? Well, the ones that are come to the top of the head, you smoke, you get lung cancer. Very quick. It's one of the quickest ones that we get. Well, There's cancers, laryngeal cancers. It's not quickly the ones that come to mind. If you stay in the sun too long, skin cancer happens a lot. These are the ones, again, that come to mind. Leukemia. When people talk about brain, what do they talk about? It's not readily coming to mind. What happens? Now, bone cancers, Ewing family of tumors. There's multiple tumors that happen all over the body. Bone and soft tissue, cartilage, can't walk, can't talk. There's cancers that could happen to you in the esophagus, can't swallow. Now, if you can't swallow, you know that if you're having hard times eating and digesting food, another cancer that quickly comes to mind is stomach cancer. The digestive system is one in which that we know very well. Everyone is talking about, please don't drink something, don't eat something, don't warm up this plastic, it can cause cancers. Don't drink this juice, it can cause cancer. Don't do this, it can cause cancer. Now, we have to think about if this is a comprehensive list and systems that we all have as humans. Now, why is it that if we just come right back out of the cancer dimension, that in the United States, African Americans take up about 13.6% of the population. Let's say half of that population is women. So let's say about 7%. 7% of the population in the United States has the highest percentage of mortality rate of Black women giving childbirth in the entire world. And I'll say that one more time. 7% of which Black women take up populate the United States. 7%. This is of all ages, right? Of all ages, just 7%. And I'm using the most general form of it because I don't have the exact statistics of those who are of age to give birth, 18 plus and so on. But 7% of the United States population has the highest mortality rate giving childbirth in the world, in the United States. Now, why is it that Black women die the most here and are not even the majority of the minority community? Right? These are issues and questions that we must ask in moving forward in research. Yes, we do have a lot of computer science and AI technologies where we have different modalities, pattern recognition, computer vision, NLP, adversarial learning. We do have a multiplicity of subdomains. Now, can we use these technologies to foster research, right? To ensure data accuracy, not just in projects, but to maintain patient privacy and address the digital divide, which needs careful consideration moving forward. Now, in the African American community, we have the top 20 types of cancers. Top 20, top K. K is just a placeholder that can be changed at any given time. But here we have the top 20. Now, what are these? Well, we have breast cancer, we have pancreatic cancer, non-Hodgkin lymphoma, stomach, colorectal, ovarian, multiple myeloma, brain and other nervous systems, prostate, endometrial, kidney, esophageal, lung, bladder, oral cavity, and pharynx, gallbladder, liver, thyroid, melanoma, cervical. In the African American community, what we realize is that even though this is one of the minorities, healthcare access is a question that needs to be undertaken. Because the multifaceted nature of these disparities demands urgent attention and um, urgent attention from researchers, policymakers, healthcare providers, and the community. Right. So this is to bring awareness again to dismantle systemic barriers contributing to the unequal health landscape faced by this community. So one way that we can do this, right, or research plan, is that we can use NLP or AI technologies, data-driven technologies, to understand these disparities, first and foremost. Now, there's been a ton of data, and we can harness tools such as text mining and the analysis or analytics of health records. So here, I want to mention that text mining and the analysis of health records is a methodological cornerstone in deciphering the nuanced insights within healthcare narratives. It's crucial for comprehending health disparities in African Americans. The reason why it's crucial is because it's pivotal for identifying implicit biases in clinical narratives. We can evaluate socioeconomic contexts, assess cultural competences. We can even explore health-seeking behaviors by uncovering environmental health narratives. We can even go further to track disparities in treatment plans. However, these challenges, such as ensuring data accuracy, meaning patient privacy, become a bit challenging. So to do that, what we can do is separate it into 3 tasks, right? So the first one would be text extraction. Again, text extraction is pivotal or very crucial task in NLP. So this involves the systemic conversation of conversion, the systemic conversion of unstructured textual data into structured, analyzable formats. So in essence, it's the process of discerning meaningful information from diverse textual sources. So we can consider, for example, EHRs. EHRs are electronic health records. We could even go and get data and analyze unstructured data from public health databases, right? We can also get papers, for example, in this diagram, a collection of papers to be mined, where there's existing related peer-reviewed works. There's even research studies and clinical trials, community health centers in highly Black populated cities, even insurance claims. See, these are different groups of data that can extract valuable information about patient demographics, medical history, even treatment plans. So sometimes it's really easy to get this done where you can use tools such as SPACY or NLTK to evaluate or extract key entities, such as using very common tools such as classification, tokenization, tagging, and so on. So here, what I want to make sure from the first task alone, right, we can leverage data analytics to dive into large volumes of data and clinical documents, discerning patterns that illuminate underlying assumptions, misdiagnosis, and late diagnosis. The next topic is, the next way we can do this by leveraging NLP is topic mining. So in the previous task, we just focused on the synergy of text extraction and data analytics tools. However, topic mining is a bit different. So topic mining, it involves uncovering of latent topics within large sets of textual data or even documents, right? So it employs these advanced algorithms to discern prevalent themes, right? We can discern themes, subjects, or even patterns embedded within the unstructural textual content into a more manageable and meaningful cluster. So this can provide us with meaningful insights. So consequently, we motivate the problem by unveiling these underlying assumptions, misdiagnoses, and late diagnoses, by identifying these patterns in incidences and mortality rates. Right. So what we want to do is to bring forth a multidisciplinary or multidimensional perspective, uncovering subtle patterns that traditionally use or not use, excuse me, traditionally not use statistical analysis that might be overlooked when collecting all of these data of mortalities and when a patient is diagnosed or misdiagnosed, if they're collected, when they're collected, and who collects them. So the last thing is when doing this, we can make a more, we can build on this systemic evaluation of these factors that influence an individual's ability to assess or access healthcare services. So healthcare analysis or healthcare access analysis is more so a social analysis problem where it scrutinizes the barriers and facilitators impacting healthcare utilization. So this is a study on its own where we can offer valuable insights into disparities and inefficiencies within these systems by investigating the impact of socioeconomic factors on healthcare accessibilities, right? So here, theoretically and empirically, in this task of health mining records, right, we can understand things such as geographical location, right? Does that play a role? Socioeconomic status, does that play a role? Insurance coverage, does this play a role as well? By getting the answers of these questions, we intend to understand disparities of cancer research and health disparities and find the determinants of what happens into the lives of millions of people who are affected by cancer in the United States. The next thing, what we want to do is focus on the identification of social determinants and barriers to healthcare equity. So again, more of a talker, so there's not much on the slides. So please do bear with me for a short while. So the identification of social determinants and barriers to healthcare equity is more of a social analysis problem, right? These are questions that researchers, policymakers, and even people in the medical field can come together and ask these questions where we can try our best to unravel the intricate web of health disparities in African American communities. This task, it is paramount for addressing systemic issues that perpetuate health inequities. So here, in recognizing the multifaceted nature of health disparities, it can encompass these three, and I haven't written them here, so my apologies, but it can it can employ three subtasks. So first, to identify social determinants, we need to first identify root cause. So to identify root cause or root causes, it's a more of a multidisciplinary task, right? So it takes the medical field, biology, chemistry. It goes from a social science perspective, psychology, and computational. Much more as well. But it begins with identifying the root cause by conducting comprehensive analysis aimed at pinpointing fundamental factors responsible for a particular outcome, right? So here you have to encompass analytical frameworks to understanding these causes, right? So these are, when you identify root cause, one thing that we must understand is that um, healthcare disparities are often a symptomatic, um, they're often symptomatic of deeper social issues, and therefore the focal point of identifying root causes is to analyze the socioeconomic determinants that contribute to health disparities by exploring factors such as, especially demographic factors, which can be classified into three tiers, which are personal, personal, um, social, cultural, and organizational, right? I can make this very clear coming down to the end. But for personal, it is our appearance, our personality, our thinking style, our race. For social, our language, where we live, our nationality, our culture, right? Our religion, our education, organizational, work status, title, marital status. These things are much more intertwined into who we are than what we are. But here, when it comes to identifying these root causes, can we understand the coupled relationships between those tiers? And now we can explore factors such as income inequality, education, educational disparities, right? This task is to um, understand even occupational challenges within each population, especially the African American population. So for instance, you have structural integrities that are deeply embedded into societal systems and are often uh, rooted by these health disparities, right? So here you can even understand or characterize in depth or scrutinize issues based on healthcare practices in different geographical locations, cultural competency gaps, or an equal distribution of resources. So the conversation of resource allocation is one that we see all the time. Why does this school look better than this school? Why does this block look better than this block? Why does this building? Why is a building going up here, but 2 blocks away there is an entire block of abandoned houses? If you guys are not sure, I work at Morgan State University in Baltimore, and in Baltimore, on your way to out of the city. You could go into the city, built up, very beautiful city. Right outside of that city, um, there's blocks. I tell you, blocks of abandoned houses. Not a single house, like an entire block and blocks at that of just abandoned houses. And then you have young kids walking through these blocks to go to school, trying to go to school. So then it comes to the question of the other task. How can you identify social determinants? And we go to geospatial analysis. Now, in geospatial analysis, here it's a computational task. It's a powerful research methodology that investigates or examines geolocation, right? So by using geospatial analysis, you can examine, interpret, and visualize patterns and relationships within geographical data. So then you ask the question, why this approach? Well, geospatial analysis enables the integration of socioeconomic data within geographic factors. What is the top insurance company in one neighborhood? What is the cost of living in one neighborhood? What is the cost of living of the neighboring neighborhood? What is the schools, the healthcares, number of medical facilities? How many deaths have been here? What's the location of these people? When they do come to the hospital and they're diagnosed with these chronic illnesses and cardiovascular diseases and cancer disparities, are they from the same neighborhood? Are they from a different neighborhood? See, by overlaying this data on hospital locations, medical facilities, and accessibility metrics, we can discern patterns of resource allocation. For a start, see, this facilitates an understanding of healthcare deserts and areas within limited access. This is crucial for unveiling disparities in healthcare infrastructures. So here, by doing geospatial analysis, specifically, we aim to examine spatial distributions of income levels, employment opportunities, educational resources by investigating how marginalized communities that are predominantly African American bear disproportionate environmental burdens. Here, what about pollution? Now, mapping pollution sources can lead to understanding the exposure of risk. You have communities and then you have a plant a couple blocks away. Some people don't even like people smoking in the same room as them. Now, so if you have the spatial distribution of the environmental hazards, we can provide some insight into the intersectionality of these socio-environmental determinants impacting these health outcomes. By doing so, you can quantify these health disparities. Right, so as a first step, we can propose a theoretical investigation of areas of healthcare delivery and where they may fall short. So healthcare disparities are rarely the result of a single factor, but instead they emerge from the intersectionality of various social factors layered into the nature of health itself within the African American populations. So here you can narrow it down and just might say it can be the interplay of socioeconomic status, of race, and gender. The next thing, or the last thing I would talk about, is trend analysis and forecasting. So trend analysis and forecasting in healthcare actually represents an indispensable compass for researchers navigating the complex terrain of health disparities. So as we mentioned before, in our task, mining healthcare records, the identification of social determinants and barriers to health equity, trend analysis and forecasting can be a large area where you can break it up into more tasks as well. So here we have a picture that I used that can benefit from trend analysis and forecasting. But in the quest of healthcare equity, we have to break this down into how can we use trend analysis and forecasting. Well, the first thing to do trend analysis, you must do temporal analysis. But what is that? Right? So temporal analysis is examining the changes over time, changes in healthcare utilization, preventative care, disparities in medical interventions over time. Medicines change, ingredients change, even what's going on in a neighborhood. In some African American communities, you have a multitude of fast food restaurants, but if you go in other ethnic communities, there's little to none, or they're actually big chains. Why is it that there are always corner stores and always these fatty food places when you go into these African American communities? But they don't exist in the cities or in suburbs, right? So temporal analysis actually, the goal of it is to formally track changes in income, education, employment, status, buildings, ingredients, things over time to identify long-term trends by using tools such as time series analysis, right? So in this way, we can offer a deep understanding of how socioeconomic factors interact and evolve. The next thing we can do is we can forecast and see data analytics or try to understand data analytics for prevention. So preventative and predictive analysis, we can try to understand or can attempt to understand the impact of environmental factors such as neighborhood conditions, pollution, access to green spaces on healthcare, right? So uh, to address these issues, or basically the scope of the project, in closing, uh, our goal is to break into healthcare by leveraging data, statistical analysis, or statistical algorithms, and machine learning techniques to identify and anticipate potential health challenges. So here we proactively aim to intervene and intervene to identify and anticipate these social challenges by analyzing data related to um, healthcare policies in terms of cancer, institutional practices, and systemic biases, and trying our best to predict risk factors. Right. So understanding these, um, by understanding these different tasks, what we want to do is to understand or take into consideration socio-cultural determinants that are crucial for understanding. So, um, in closing, um, our goal is to develop a standardized framework to navigate these challenges ethically, ensuring that the integrated data sets are accurate representatives and our goals are aligned with the principles of healthcare and health equity in African American communities. Thank you so much.
Thank you, Dr. Dacon, for the wonderful talk and tell us a lot about the health disparity research. I have a couple of questions for you. First of all, what are the computational approaches that you think that can deal with health disparity issues in your research?
Oh yeah, that's a good question. So the health disparities, so it really depends on the type of health disparities that we're trying to uncover. So one thing that I would really want to do is what I'm really excited about is when I start this. So this is a project that we're about to start during the summer. The first thing that we're going to do is again get data and do the geospatial analysis. So the geospatial analysis one is what we're going to do. We're going to use Python and we're going to build plat maps and density maps of the United States, where we can get the top 10 states where African American communities have the largest population, and plot healthcare facilities, hospitals, um, medical centers, and so on, and see if that plays a role with states that they are not the highest population. Now, so we can use things such as, I don't want to jump straight to insane classification algorithms, but what we want to do right now is we want to scrape a lot of data and get a lot of policy data, insurance data, and medical data from hospitals. But we do have to put in some little application for those because it's not easily accessible, because it actually reflects a lot on medical facilities.
Okay. Thank you. And in your opinion, what are some of the challenges and gaps in health disparity research currently?
Yeah. So in the recently, um, in health disparities in general, just using the example of mortality rate of African American women giving childbirth to be 7% of a population in any country, it's very concerning that out of that 7%, it's not even the full 7%. It's has the highest rate um, or mortality rate giving childbirth of African American women in the world. And I think that's something that is needs to be undertaken, where we can go into insights and then understand if there needs to be more training. So one thing is that when you're in the medical field, we have a multiplicity of cultures and ethnicities, races, languages. Um, we're different yet the same. However, there needs to be more in-depth study of what happens if something doesn't look like what I'm used to. So there was a an assumption that Black women has have a higher tolerance than women of other ethnic groups. So the dosages used to be lower, the cuts used to be deeper, and then understanding that this wasn't the case, a lot of people lost their lives. So there needs to be a very comprehensive and immersive study within different ethnic groups within social and health disparities so that we don't make these foolish assumptions where we take lives for granted because of some assumption because you look differently, not because you cut someone or when you're doing surgery and something doesn't look exactly right or you don't it's not the same color that we assume that nothing is wrong. So this actually enables late diagnosis and misdiagnoses. And now you have someone who can go into the hospital for back pain and they're just like, "Oh, you've been working too long," or "You just retired. You've been working for a couple of years," not knowing that there's a tumor there, not knowing there's a benign or even a malignant tumor growing or spreading. One thing that's really hard to understand is the soft and bone tissue cancers, and it's actually pretty prevalent in the Black community. Uh, but first, we want to do is we don't have enough data when looking into all of the cancers that we saw that were listed in one of the slides. So what we want to do is focus on the top 10, top 20 uh, cancer disparities found in African Americans because there's a lot of work that's done there, and we believe that we can do a lot there.
Thank you very much, Dr. Dacon, for finding time to give your insights on health disparity research and about your own research. And I will definitely connect with you uh, to collaborate on some of the projects that we have currently running.
Of
Um,
course,
Thank you very
definitely.
much.
I do. Before you go, I do would like to definitely collaborate. Probably talk because of the nonprofit that I'm running. We try to have a REU this summer and having well one or two students from your university who might be interested in something like this would be really nice. So that we can further our collaboration and also work towards having healthcare equity.